Busia Senator Omtatah has moved to court to block the implementation of a multi-billion-dollar health deal that is signed between Kenya and the United States. The binding cooperation framework commits about 208 billion shillings over 5 years. The agreement is designed to strengthen detection, prevention, and response to emerging and existing infectious diseases in both countries. Funding will also support the establishment of 10 regional health institute hubs and 20 county emergency operations centers. NTV's Helen Aura has the details.
For decades, U.S. health funding to Kenya, especially for HIV, TB, and malaria, flowed largely through non-governmental organizations. According to an audit, Kenya had more than 150 such organizations managing donor-supported programs, but with many of them carrying administrative overheads, sometimes above 60%, less than 40% of the money often reached frontline health services.
Less than 5% of the budget was actually going to lab diagnostics. So most of the time the labs were grossly underfunded. And I think it's for historical reasons, mainly because most of the disease priorities like malaria, TB, polio, sexually transmitted illnesses, measles, and the rest, a lot of them were funded through donor funding. Either the president said they want to cut the middlemen and deal directly with the government so that the funds goes straight to the Ministry of Health through its existing mechanisms. And if you look at it, the fund is supposed to go through KEMSA for supplies, go through the Ministry of Health in terms of personnel, whatever is being trained, all the things will go straight to the ministry, and there will be a payment model through SHA.
The new Kenya-US government-to-government health cooperation framework aims to change that, ensuring Kenya fully drives its health systems, with the US playing a support role. Busia Senator Omtatah maintains the recently signed cooperation framework between the government of Kenya and the United States was negotiated and executed in violation of the constitutional principles of public participation, transparency, and accountability. This is the second petition challenging the deal after the Consumer Federation of Kenya sought conservatory orders to stop the implementation of the framework pending determination of the case.
Yeah, so these are the ones we prepare.
The U.S. government currently funds approximately $14.9 million of laboratory commodities and approximately 515 frontline laboratory workers in Kenya. Central to the agreement is the establishment of a resilient and tiered laboratory system that ensures sustained access to diagnostic services across all regions.
The event that there is a rare disease that comes up that we hardly test, then it will be prudent for samples to be sent to either WHO reference laboratories, which there are specific labs across the world, very few of them, that have this capacity, or CDC. Now, in that event, then there is a framework already. It has been happening, and it has actually been strengthened. It's actually anchored in the law for samples to be transported to the point where they need to be transported and analyzed, and the results that come out of those laboratories actually belong to the lab that send it. And there's a data protection there in terms of the lab that is testing. It cannot utilize that data for research, for publication, for even reporting without concurrence and authority from the originating lab.
Omtatah maintains he is opposed to the move as it exemplifies executive overreach, potentially exposing public health resources to inefficiency, corruption, and conditionalities that prioritize foreign policy alignments over domestic needs. Helen Aura, NTV.